I imagine the ring provides some hemostasis a little bit on the little stuff too. When I think about our transvaginal tissue extraction, when we put the ring in, put the bag in, it's putting significant pressure on the vaginal cuff for the time that we're doing our morcellation. When you go back up above and close the cuff, there's been like somebody holding pressure circumferentially for whether it's 10 minutes or an hour and a half, depending on the uterus. You're providing some hemostasis. Does the ring itself provide some additional hemostasis and vNOTES in the same way?
It does. It's exactly like you say, it compresses, but once you take it off, you have to check your hemostasis again. I think a second thing that it does is it lateralizes your ureter. And we did some cadaver study to look at that. But because that Alexis ring pushes on the pelvic sidewall, it automatically pushes your ureter more lateral. And we saw when we did the dissection without the Alexis in place, we sort of had, 2 inches between the pelvic sidewall and then a natural position of the ureter. And when we put the ring in place, that reduced to 1 inch. So it lateralizes your ureter about 1 inch. And that I think helps. And I think that's what we've seen in the studies that have been published so far, is that we have less ureteric injuries than in laparoscopic surgery or laparoscopic hysterectomy. But we have a slightly higher rate of cystotomy. And I think it makes sense because, you're doing that dissection vaginally.
That's what we all fear. That's what we all fear, is doing that colpotomy, is getting in from above or from below. I think that's the kind of thing that with time, I think that rate will go down, but you just have to understand there are trade-offs.
That is the one to be aware of. I think it's logical that our cystotomy rates are a little bit higher in the vNOTES studies than in the conventional vaginal hysterectomy studies because we're tackling more challenging cases. We're doing bigger uteri and bigger myomas and multiple C-sections. I think what helps there is, but this is now very technical, but I'll stay brief, is that instead of making your colpotomy as you do on a vaginal hysterectomy, just with cold scissors and a forceps, is to actually make it endoscopically. So you can place your inner Alexis ring in a way that it is between the vaginal mucosa and the still closed peritoneum. And then you can make your dissection for your anterior colpotomy with endoscopic instruments. And I think with that, we now see that our cystotomy rates are going down.